Okay, so here's better. So good was using the Q1000 and the 808, stimulating that area. But a better way is to use the light of the laser and then a scanar. And a scanar absolutely helps the body, like a female, organize. This gives the energy for the cell to regenerate. And then this helps the kind of like the magnetics in the cell and around the cell to be able to attract and keep more light, or in this case, to able to actually help the body heal like nothing ever happened. This is male, and this is the female. This is light, in this case, it's electricity. Now, the scanar is called a self-controlled energy neural adaptive regulator, and the one of my choice is called the Dove. And it's actually called, whoops, let's see if we got it there, DOVE, a device which organizes vital energy. Now let's go back to that where that necrotic tissue was, or where that issue is. And one of the things we know about the scanars, it needs to be put on the skin directly. So if we put it on, we're going to go also to that area where it actually sticks the most. And in my case, it's right here. So I'm going to hold it there until it stops beeping, or in this case, we're going to see an M1, an M2, and an M3 light. Now, when people ask, well, can I laser and scanner at the same time? The short answer is yes. In fact, that's the best. And now I'm going to use the laser, and in this case, I can put it on the other side, and it will still help the way that the Dove works on the other side, because we're a series of tubes, and what I put in one area actually will cascade and go into other areas of the body also. Now we're almost at the place where one of these lights is going to go on, and hopefully we'll do it any second. Here it goes. I've dubbed enough to kind of know, and here, come on, here we go. And the little light will go on. There we go, M1. Okay, and I'm moving it around again, and I'm talking, so it may go on and off there. So now I like to call when M1 goes on, the body's hearing that signal of regeneration 25%, and it will stay on. And then it will go to M2, and that's when the body's going to hear, and again, it's a generality, hear that signal of regeneration 75%. And then the magic happens when that M3 light goes on. And you're going to probably see me take a deep breath ahead of time. So that's when I kind of know something really good is going to happen. And then here it comes. Oh, so any moment we should get the dose. And here, and then it will do a series of beeps. Do you hear the beeps? Okay, those beeps are telling me that the minimum amount to make a profound change has happened. Now, the other thing is the longer it beeps, the more I like to call it's creating a bridge for that body to actually heal. After that's completed, I can now take it off and I can move it around a little bit. And now it's not sticking in that spot like it was. Now it's actually moved. And that's what we're going to do. We're going to chase the pain, or we're going to chase the sticking. We're going to chase the area to the next place for us to give that dose, to give that love to the body, the minimum amount to make a profound change. And isn't that kind of fun? And that's what makes the scanar so different than any of the other devices, is it gives us the ability to know when the body has enough to make a profound change. That could take a practitioner years and years and years and years and years to know. But now in the hands of a layperson, in the hands of someone brand new, I mean, we could just mail this thing to you. You could have a pain or a discomfort or a shoulder tear. We can put the device on there. You go to the area where it sticks the most, and then what happens? We'll let it go through M1, M2, M3. It goes beep, beep, beep. Then what happens? You actually will let the person, how do you feel? And they're going to go, oh, I feel a lot better. And you know they feel better because you got the behavior, you got the, the biofeedback, the actual feedback that in fact something major has happened. And we call that the magic of the dose. So again, I'll put it on an area. Now it's sticking lower. So I'll put it there. And by the way, just for your own little input, I had some pretty major dental surgery last week. And I'm not sticking here at all anymore. Now, last week I was, especially before the dental surgery. That infection's been cleared up, but it doesn't mean that it's cleared up everywhere in my dental structures. So I was good at doing that. And then I'll tell you something that Dr. Arena and I had worked on. And if you ever had a nagging partner, it was me. And I'll talk about the nagging a little bit, and that is to find a special probe which we could to put on the cosmetic device and absolutely to help the body heal even cracked teeth. And I learned about that later than when my cracked tooth happened. I did the best I could working with my dentist to seal that cracked tooth, but over the next 6 to 8 months, infection still came in. And I didn't have the newest, latest, greatest way to help it. Even though I nagged Dr. Arena to be able to provide and to get us that, what the Russians were using for many years with cracked teeth, I heard about it a little bit too late. But you didn't hear about it too late, at least I hope in your case. And in the next video, we'll talk about the good. Then we use this one, the better way of working, using a laser and a scanar. And now we're going to be doing laser scanar, and the scanar being cosmetic, and how that helps even more work on even more tissues. Now, by the way, the more we put attention to dental, the more other parameters of health, people's health, gets better. That's kind of cool. As well as we're hearing better. We're going to be seeing better. We're going to be, in a way, some people say they taste better because their sense of smell is increased. And we'll see how blood sugars can regulate and how little things like the eye crows can go away. And we can regenerate these tissues and work and stimulate these nerves that are in this area, especially in the dental area, which will also help our beauty. So we can look better today and tomorrow than maybe we looked last year. So this is Doc David Gawain and the Natural Transformational Healing Services, and that's .com. Doctor Empower. We'll talk to you soon.